Away from that now to Southern Africa. A union leader in Mozambique, Asalma Muchave, says more than 1,000 people have died because of a lack of care amid health workers' strike. According to Muchave, most of the reported deaths were in the provinces of Inhambane and Sofala. Now, the strike by 50,000 union members began 3 weeks ago after negotiations over working conditions collapsed. Nurses, psychologists, drivers, and cleaners, among others, those that are striking for overtime allowances and better medical equipment. Mochave said the workers were forced to strike because they face such dire conditions which the government are refusing to confront. The Health Ministry has in the past accused the Association of United Health Professionals of Mozambique of exaggeration. And now to discuss this, we are joined by the chairperson of the Health Workers United, Anselmo Mochave, and he joins us from Maputo, Mozambique. Thank you so much for coming on. A very good day to you. Let's get started. How can we verify the reported deaths of 1,000 people attributed to the strike? Let's start from there, right? And then we can move on to more. But how can we verify this number of people that have now died?
Yes, afternoon for all Africa. I'm here to tell about the strike, because you started this strike for 2 weeks ago, and we start negotiation last year, 2023, and the government don't do nothing about the changes and has hospitals. And what is the government doing? The government all talk but don't change nothing. We talk about medicines. We talk about the beds in hospitals. You talk about the material to X-rays, essential medicines like antibiotics. Our hospital don't have this material since last year, and our government every single day said we can. They change something, but nothing is changed in our hospitals.
Anselmo, the government have accused the workers of exaggerating, the conditions and the things that's the conditions that the workers face, right, and just the state of healthcare, right. But now this number that you're saying, 1,000 persons have died due to the strike. Can we verify this? Is this true? Is this true in terms of the government saying that it's exaggerated? Are there independent sources of information from these provinces, which is Inhambane, Bain, I beg your pardon, and Sofala, to corroborate these numbers of 1,000 people? That is a lot.
Let me tell you something. We closed all hospital in Mozambique. You understand? And we have many. You have health workers in another hospital to take care for minimum service. That's why you have real numbers for this striker. The government don't make good analysis about the real number. This government work bad such long years ago, and that's why the government don't have a real number. If the government need the real number, we can give the government the real number, because the government don't have the real number, because work like that for a long time. We can give this number, because how the Inhambane and the Sofala has this number.
Right.
Inhambane and the Sofala have this number because many hospitals is closed totally. Many hospitals is closed totally, and the people need doctors in the hospital, need the health workers in the hospital, and no one go to hospital because the government refused to change the situation in the hospitals. Imagine the ambulance and another hospital work without petrol and electricity. How the many surgery make the surgery in hospitals? That's why all health workers now is stay home waiting for the government to change something.
So the impact of the strike on Selmo is on different healthcare workers is that they have now stayed at home waiting for the government to do more, right? And you're saying that this numbers in Himbani and Sofala, it's far more, and the government is refusing to accept it. Now, beyond rejecting the death toll claims, right? What specific actions is the health ministry taking to address the workers' demand and end the strike once and for all?
The first thing, we need medicines in the hospital, because the people now will look for the health workers. Like the health workers steal the medicines. The health workers don't want to give food for the patient. And we need the government. You can ask them, health minister, how long don't give uniform to the health workers? And they ask you, how long don't give food for the patient in the hospital? And how long?
Anselmo, I can hear you. Anselmo,
sorry,
you there?
I'm so sorry.
Go ahead, please.
Yes, I'm so sorry. And you can ask for a health minister for how long the health minister don't give medicines in the hospitals, don't give essential medicines like antibiotic, Nurofen.
Anselmo, many thanks for coming on. We appreciate you for doing this. We'll continue to follow this story as it unfolds, and we do hope that this strike doesn't last long. That's Anselmo there, all the way from Mozambique, talking to us about the Health Workers Union, their strike.